Marcia Pappas is the president of New York State chapter of the National Organization for Women. She joins us now in studio to talk more about this issue. Marcia, thanks so much for joining us today.
Thank you for having me here.
And this is a complicated issue. It's one with a number of sides. If you could just, in your view, give us the background of the situation.
Well, you know, we've always been a pro-choice organization. We support pro-choice candidates for office. We warned the public that, you know, Obama did not have a great record on reproductive choice. Now we see the Health Care Reform Act attacking women's rights in terms of abortion rights. It is a health care issue. Most recently, what we're concerned about is the Department of Health and Human Services drafting policy that will basically say, on top of the fact that women are not going to be able to get abortion even if they pay for it out of their own pocket to insure themselves, now they're going to be attacking women who have life-threatening diseases such as cancer, AIDS, diabetes. Those women who could have very complicated pregnancies are now going to be restricted from having an abortion, even if they pay for this out of their own pocket in terms of their insurance.
Now, people really were waiting to see what President Obama was going to do here. He could have acted either way because Congress didn't really define abortion. They stepped away from it a little bit. Were you surprised by his actions here?
Well, you know, I'm never surprised at anything that elected officials do. They're very cautious. They walk gingerly around a lot of issues that we care about. But the fact remains is that women who are progressive and even conservative women now need to be very concerned about the fact that this is a health care issue that they could be told by their government, you can't access this health care provision. And women's lives are going to be in great danger. We have now women who are out there looking for abortions. 87% of the counties in this country don't provide for abortion services. So it's going to be even worse if this policy goes through. And we're very concerned about that.
Well, how are you advocating at this point? Are you trying to get the White House to reverse their decision?
Yes, absolutely. We think that it's absolutely imperative that our Congress people and our senators push President Obama to say he's going to reverse this decision. We already have the Hyde Amendment. We can't use Medicaid funding for abortions in this country unless the state picks up the tab, which in New York we do. But again, we need to say to the president, there are women out there that are going to need to access health care for reproductive rights, and they should not be denied access.
And now this is a debate, two sides to every debate. The Catholic Conference is actually celebrating this decision, saying that this is a win for them and this is a step toward what they want to see.
Well, the Catholic Conference would like to see all birth control and abortions outlawed, and we think that's absolutely ludicrous. We believe that women should have control over their own bodies, and they should be able to decide when to bear a child.
Certainly a heated debate on both sides, and people take a number of stances on this. It certainly is going to impact the midterm elections. What do you see happening here with the stance that people take on either side of this issue?
Well, you know, we're starting to say now that the word Democrat is not synonymous with being pro-choice, and we're seeing this every day. Certainly Republican, the word Republican has not been synonymous with being pro-choice. But having said that, I think people need to be very careful about who they're voting for. They need to look at their voting record. How are they committing to these issues that protect women's health? This is not just about abortion. It is a woman's health that is in jeopardy. And we need to be looking at the candidates who truly have a record on voting for women's health access, and we need to be following through in the voting booth.
Bringing this back to New York State, what do you see in terms of people who are running for the New York State Senate or New York State Assembly? Have you been pleased with what you've seen?
In general, I think we have a pretty progressive state. I think that, of course, you know, we have our conservatives in New York. But again, I think in the voting booth, we have to be very careful about how we pull that lever and who we pull it for. You know, if we are going to be in jeopardy in New York, that's going to be serious matter that we have to talk about. One of the things that we've been doing is working in coalition to try and pass the Reproductive Health Act, which has been introduced by the governor. And we're hoping that this will eventually happen. It will take the abortion rights out of the penal code and put it into the health code where it belongs, because it is a health care issue.
And you are supporting Governor Patterson on this issue?
Oh, we absolutely support him on this issue. We think it's imperative that this law is passed. Women in New York need to be protected.
And now, when you see this going forward, you see this really becoming a hot button issue. It was one of the hottest issues debated in that health care bill. Why do you think this impacts so many people? Why do you think people get so riled up about it?
Well, you know, one of the things that we've always said is if a woman cannot control her own destiny in terms of when she bears a child, it impacts her entire life. In fact, it impacts the entire society that we live in, because women that are forced to bear children when they're not ready are put in positions where they need public assistance. Their children do not necessarily have the same access to opportunities that other children would have that grow up in a community where they are wanted. And so it impacts us greatly, both men and women. You know, when we look at the fact that women of younger years could be forced to bear children before they're physically ready to bear those children, that has a physical and a health impact on those young women. So there's lots of ways that laws such as this will impact women not only financially but physically as well in terms of their health.
And politically and legislatively, it is something that's become something that people do take a stand on. This becomes law. How do you think abortion as an issue is appropriate to legislate?
Well, we need to say to our legislators, women need to be able to have control over their own reproductive health systems. They need to have control over their own lives, just as men do. And legislators need to stand up and take a position and say, you know, you are equal. You are equal to men. You should be able to make those decisions based on what's happening in your own life. And they need to show us that they're going to vote appropriately on these pieces of legislation.
Well, in terms of people taking stances, President Obama did take his stand. He put this provision in there until, you know, it's the interim until it kicks in 2014, the full health care bill. How do you think this is going to impact the 2012 elections, the presidential elections?
I think that the pro-choice community is going to look very closely at how people are legislating in their states and in the federal government, and they should be doing so. This is a real problem in terms of people having freedom over their own bodies.
Well, you brought up Democrats earlier, President Obama, a Democrat, a number of conservative Democrats who made sure that abortion wasn't going to be federally funded. How do you think they're going to be looked at in their communities and by the pro-choice community?
I think the pro-choice community is very disappointed right now. They've spoken out quite clearly. We've seen some press releases from other organizations that are pro-choice. But again, I will say that this also is going to impact conservative women because it's a health care issue. It's not just about people having abortions. This is about women that are going to need a health care that could be very much needed, whether you're conservative, whether you're progressive, whether you're middle of the road. I mean, this is not something that people wake up in the morning and just decide at the last minute, gee, I think I'll have an abortion today. Many women take this very, very seriously. They think about it. They talk with their doctors and their families. And for many women, they will risk their health, but that's their choice if they want to do that. I don't believe that the government that should be legislating women risking their health.
And now going back to 2008, you've been a vocal opponent of President Obama in terms of his stance on women's rights. As an organization, do you think you would be hesitant to endorse President Obama?
Well, I can't speak to the endorsement because that is an issue that would actually come out of our national office in Washington, D.C. We have a PAC that makes those decisions, and so we'll see what happens. We'll certainly have a discussion about it.
Yeah, I'm certain it will be quite a discussion going forward. Thank you so much, Marcia, for joining us. We appreciate it.
Thank you very much.